Welcome, I'm Dr. Dawson. At some point, there's a doctor somewhere that's going to tell you that one of your children has a heart murmur. And you're going to freak out and grandma's going to freak out. So let's talk about it a little bit and see if we can worry a little bit less. So what a doctor's saying when he says he hears a heart murmur is he's saying that he hears some vibrations. Easiest way to think of it, if you think about grabbing the garden hose in the middle and then turning the water on full blast, you can feel the vibrations of that water going through the garden hose. And if you were to take your stethoscope and put your stethoscope on the garden hose, you could hear the vibrations going through the garden hose. So that would be a garden hose murmur. And that's what a murmur is. The doctor is just hearing the vibrations of the blood going through your baby's heart. When you consider the fact that a baby's heart is about the size of their fist and it beats about 100 times a minute, that's a lot of blood going through a pretty small pump and making a lot of sharp turns. It would be surprising if you couldn't hear a murmur on babies almost all the time. And the fact of the matter is, you kind of can. But in any event, if a doctor tells you that he hears a normal murmur, he may call it a physiologic murmur, then that's something you don't need to worry about. You may also hear it referred to as a Stills murmur. That was named in honor of good old Dr. Stills, who was sort of the father of pediatrics in England about 125 years ago. So any of those things are fine and no need to worry about that at all. Now, the abnormal things that can cause murmurs are primarily caused by the baby's heart not having finished the process of being completely formed at the time that they're born. Easiest way to understand this is to think of your heart as two pumps. The right-sided pump is a little smaller and weaker, and it gets the blood from your body and pumps it through the lungs to get oxygen and air. And then that blood goes to the left pump, which is bigger and stronger, and it takes that red oxygenated blood and then pumps it all through the rest of your body, all the way down to your toes. And since it's harder to get the blood to go all the way to your toes than it is just to go to your lungs right here, the left side's a bigger and stronger pump. Now, whoever was in charge of construction decided that it would be simpler to just put the two pumps in the same place. So that's what they did. And to further ease in the construction bid, they decided, let's just make one big pump with strong muscles all the way around the edge, and then we can go back and put a little partition down the middle, and we could divide the one big pump into two pumps. And that's what they did. Now, sometimes when your baby's born, that partition between the two sides hasn't completely sealed off, and so there's a little gap remaining. And so when the stronger left side pumps, it pumps a little bit of that blood through a little hole to the other side, where then the right pump has to pump it through the lungs again. So that's the proverbial hole in your heart. That term, I think, freaks everyone out because everyone imagines that there's this big hole in the side of your heart that every time your heart beats, it's pumping the blood outside of your heart somewhere. But that's not what's going on at all. The left pump is just pumping a little bit of blood through the little gap in the partition, and that blood going through there is making a vibration. If that gap in the partition's in the lower half of your heart, we call that a ventricular septal defect, or a VSD. If the hole in the partition's in the upper half of the heart, we call that an atrial septal defect, or an ASD. So those are two of the common causes of holes in your heart. And then the other common abnormal murmur would be what's kind of interesting. It's called a patent ductus arteriosus. And it's interesting because when your baby is inside you and underwater for those first 9 months, they're underwater, so their lungs aren't getting any air. All the oxygen they get comes through from you, through the umbilical cord and the umbilical vessels. So since there's no oxygen in their lungs, it's kind of a waste for that little right pump to pump all that blood through lungs that are underwater before it goes to the left side. So the contractors in charge made a little conduit to go from the right side, skipping the lungs, and straight over to the left side, saving that baby's heart all that extra energy of pumping through lungs that are underwater. Then as soon as your baby is born and they take their first breath of air and fill their lungs with oxygen, that little conduit closes off all by itself, forcing the blood from the right pump to go through the lungs and get the oxygen before going to the left side to be pumped throughout the body. I think it's amazing that all those things happen both prenatally and around birth, and so that's fascinating. But sometimes that little conduit doesn't totally close off, and there's a little bit of blood that squirts through there, making a little vibration you can hear, and that's a patent ductus arteriosus, or a PDA. So now you know about Stills murmurs, you know about VSDs, you know about ASDs, you know about PDAs. The nice thing about most of those problems with the heart not being quite finished developing is most of those clear up on their own in the first few weeks to months. So you just sit back and let the little partition continue to close off. You let the little conduit continue to close down, and those things usually go away by themselves. And so if you're not worried, then, I mean, not you, if your doctor's not worried, then I certainly don't want you to worry. The other nice thing is, even if we have some of these things that don't clear up quite as quickly as we'd like, now we're blessed to live in an era where almost everywhere has easy access to ultrasound, where we can just look and see where those vibrations are coming from. The other nice thing is in the last 60 to 70 years, medicine has made a ton of progress in terms of children's hearts. And I can remember 30 years ago, I had a little boy in my practice who was born, and his heart only had 2 chambers instead of the normal 4. And so it made all the red and blue blood just mixed together in these 2 chambers. And he was as blue as could be all the time. And those first years, when he would come to the office, the other moms in the waiting room would freak out when they saw him, and they'd run up to the receptionist and very generously say, "Let him go first. My children can wait." But he was fine. And then probably around 3 or 4, he had his second surgery, and they fixed that defect so well that he eventually was able to play on his high school basketball team. So if we're talking about little vibrations that either are normal, or they clear up on their own, or they can be fixed with the technology that we have now, then I want you to worry less. I think that doctors probably mention murmurs too much. I think medical students and young doctors, probably mention them too much to prove that they're real doctors. And I think that old doctors mention too much to prove that they can still hear. But if your doctor is not worried, then I don't want you to worry. I hope this will help you understand murmurs.